Here I'm going to do suture suspension for the mid-face and jowl, and this is a beautiful non-surgical technique for lifting the tissues of the face, brows, neck, and keeping them all coherent and pretty. Suture suspension uses a surgical suture made out of polydioxanone, which is a complex sugar molecule. And this suture contains perpendicularly oriented rasps on it that gain purchase in the tissue. And I'm able to vector or lift how I'm repositioning the tissue according to customized vectors of pull. So that can be different for each face. These sutures will gradually disintegrate over time, and as they do, they function as collagen biostimulating agents. So it's almost like ivy growing into a lattice in the garden, where after a year it's all ivy and no more lattice. So we are in a little bit of a better place than where we started. So here we've placed suture suspensions in the mid-face and jowl, and they're extending all the way into the central face to help create a deep structural pickup. And now we're gonna feel a little bit of pressure. It's kind of an unusual feeling, but it's very worth it because it resuspends the feeling of the tissues falling forward and crowding the central face. So we can already see here a really pretty improvement. The sutures and their rasps are anchored to the periosteum, and then we'll trim them so there's nothing showing when we're done. And we'll gently redrape the tissues. So in skilled and capable hands, suture suspension will not burn any bridges for future surgery. It's distinct from thread lifting, which is done superficially. This is done in the deep plane of the face. But this is a really perfect outcome. The combination of injectable filler and suture suspension, that is a near surgical result for the mid-face, and that is a near surgical result for the jowl and this border between the face and the neck.